Hello, good afternoon. I am Dr. Sreekanth Appasani, Consultant Gastroenterologist, KIMS Hospital, Secunderabad. Today, we will be discussing about a very common problem which happens to most of us, which is known as GERD, Gastroesophageal Reflux Disease, short form GERD. What is GERD or GERD? It is a word which is used for some discomfort which is happening in the chest area, in the center part of the chest. It could be in the form of a burning sensation, it could be in the form of a pain, or it could be the food or liquid or whatever we have eaten coming back into the chest or into the mouth. So these symptoms are commonly known as reflux. So before telling you what is this in detail, we need to understand a small GI physiology, how our stomach and food pipe works. Now, when we eat food, the food goes through the mouth into the food pipe, which we call in scientific terms as esophagus. Now, this food, after it enters the food pipe, that is the esophagus, it crosses one narrow path which is known as the sphincter, the lower esophageal sphincter, that is the junction between the food pipe and the stomach. It passes through that and it enters the stomach. That's where the major part of the digestion happens. Now, what happens in the stomach? Stomach secretes acid. This is a normal phenomenon. We all call acidity, acid and all these symptoms, right? Now that is because of the acid which is present in the stomach. Now, formation of acid is not a disease. Formation of excess acid is a disease. Now, this acid which is produced as a part of the digestive process, the normal digestive process, this acid mixes with the food and then that particular mixed food along with the acid goes into the small intestine and undergoes the rest of the digestive process. Now, this food mixed with the acid, or in some cases where you don't eat anything, only the acid which is produced in the stomach comes back into the food pipe and starts irritating the food pipe. That causes GERD or GERD or Gastroesophageal Reflux Disease. So that acid which is a part of the digestive process which is normally produced in the stomach comes back into the food pipe. Now, acid is a disturbing agent. It is not a normal thing. But since it is working in the stomach, it doesn't cause damage to the stomach. Our stomach is designed by God to protect from the acid. But the God did not give any protection to the food pipe. So our food pipe, when it gets exposed to the acid, gets irritated and gets symptoms like chest pain, burning sensation, some discomfort in the throat or these areas, some tightness keep happening around. So this acid, which is a normal part of the stomach, coming back into the food pipe is known as reflux. This sometimes is mixed along with the food items which are there in the stomach also, and they can also come back into the food pipe and into the mouth and the oral cavities. So for all these symptoms, that is burning, pain, discomfort, tightness, etc., which happens because of the acid with or without the food coming back from the normal stomach into the food pipe, is known as GERD or Gastroesophageal Reflux Disease. GERD causes discomfort in the area where the food pipe is there, that is in center part of the chest. It can come with burning sensation. You have severe burning happening because of the acid coming back. Sometimes there is pain. This pain can be a vague discomfort where some sort of discomfort is happening, or it may be a severe pain, something like squeezing because of severe acid reflux, or it can also sometimes cause difficulty in swallowing food. Sometimes what happens is that when a person is eating very fast or doesn't take time to swallow, these large food boluses or chunks in the presence of acidity, severe acidity in the food pipe can get stuck there, and you need to take some extra water to push it down. So this symptom can also be because of reflux. However, If this particular symptom, that is difficulty in swallowing food and food getting stuck, is there, that means there is something more than reflux. So we need to go in and check whether there is narrowing, there is other problems like tumors or any other problem which is causing narrowing of the food pipe. Now, apart from this, that is discomfort in the center part of the chest, discomfort in the center part of the chest like burning sensation or difficulty in swallowing, apart from this, it can also cause other symptoms. Like suppose the acid comes back completely back into the mouth, it can cause some irritating sensation in the mouth and in the teeth. There can be, because of the acid, there can be corrosion of the teeth and then teeth injury can happen. It can also cause disturbances to the ear because the acid can irritate the pipe joining the ear to the throat, that is the eustachian tube. Sometimes it causes throat discomfort. Sometimes it causes lung issues also. So now, as I previously told, apart from the food pipe issues, it can also cause issues elsewhere also. The most common area where this GERD causes symptoms is in the lungs. We call it as the extra-intestinal manifestation. That is, apart from the food pipe, it causes symptoms elsewhere. Now what happens is that this acid constantly, when it comes back into the food pipe, small quantities of this can enter into the lungs and can trigger a situation similar to asthma. We know asthma, that is breathing difficulty, which commonly happens because of climate change. You find wheezing, some sort of sounds coming out from the chest because you are not able to breathe properly. This particular asthma can be triggered because of this reflux also. And it can, this chronic reflux people can have some sort of situation similar to that of asthma, which causes these breathing difficulties, wheezing sounds, etc. It can also cause laryngitis, like the acid, when it passes above to the throat, it can go to the vocal cords, that is the voice box, and cause irritation of the vocal cords. As I told you, acid is good as far as it is in the stomach, but once it comes back into the other areas, it can cause injury. So if it is causing discomfort in the chest, we call it as the reflux symptom, that is GERD. But now once it comes back in the throat, it can cause disturbance to the voice box, the vocal cords, and cause chronic laryngitis, voice change, throat discomfort, chronic cough, some sort of sounds coming out because of the acid injury. So these can also be because of the chronic acid reflux. These are about the extra-intestinal manifestations of GERD. Now, what are the common causes of GERD? So, GERD is very common. In fact, if you can recollect yourself, there will be no person who wouldn't have had an episode of GERD, that is some discomfort in the chest because of this acid. That's because whenever we are exposed to this extra acid, symptoms of GERD comes in. We would have eaten outside something which is really spicy, lot of masala foods, something which is very bitter and tangy, or we would have overeaten, or we would have eaten at abnormal times. Then this acid reflux would have occurred to all of us at some point of time in our life. Now, but commonly it happens for all of us once in a while. But for these patients, that is GERD patients, it happens daily. It happens even with the normal food. So why it happens, I'll just tell you later. But we need to understand that the GERD patients experience all these symptoms almost daily or on a weekly basis, even with normal food and normal lifestyle. Whereas we experience this reflux once in a while with abnormal foods or with an abnormal lifestyle. GERD patients experience it almost daily or once in at least weekly. Now, why does this happen? It happens predominantly because of abnormal food habits. Now, what are those abnormal food habits? Eating excessive oily foods, eating excessive spicy foods, eating foods at abnormal times, somewhere like late night binging, eating at 11 o'clock, 12 o'clock, 1 o'clock in the night. The common reason which I keep hearing from my patients is that they don't have time. They are busy with their works. That's why they couldn't eat. That's not a good explanation, because we should be eating on time. Now, so not eating on time is also one of the risk factors for GERD. Now, I'll explain to you why it is not a good thing to eat so late. When we eat food, we are in the sitting posture. The food pipe is straight down and the stomach is here. The food enters from the food pipe into the stomach. Now, when I sleep, this whole thing becomes lateral. Now, the stomach and the food pipe, everything comes into sleeping posture. So the food and the acid can easily come back into the food pipe if it is not digested and it is not moved further. Average, the stomach takes at least 3 to 4 hours and up to 6 hours to empty its contents. Now, suppose if you eat food somewhere at around 7 o'clock or 8 o'clock in the night and you sleep at around 10 or 11, you give a decent 2 to 3 hours time for the stomach to empty its contents. So when you sleep, the acid doesn't easily come back into the food pipe and don't get irritated because of the food pipe acid secretions. Now, if you have a late binge, that is somewhere around 11 o'clock or 12 o'clock, you eat food and immediately you sleep at 1 o'clock, you hardly have given your stomach half an hour to 1 hour of time. So that is not sufficient to empty the contents. The contents are still there in the stomach and you are sleeping. So now it is something like the glass is full and you have made it like this, so it can easily flow back. So the stomach contents can easily come back into the food pipe and cause irritation, causing GERD. So excessive oily foods, spicy foods, eating at abnormal times, not giving a gap between your last meal and the sleep are one of the most common reasons for GERD. Smoking, alcohol and other addictions like tobacco chewing can also increase the reflux. The third common reason is the presence of a hiatus hernia. Now, I want you people to understand that this hernia word which I have used is different from the other hernias. The other hernias are different places. We get swellings in the groin and in the testis area, etc., and that needs immediate surgery. Whereas here we call as a hiatus hernia, that is the junction between the food pipe and the stomach is a bit loose. So this is present in many people by birth. So this hiatus hernia can be there since birth. It is not that you acquire it later. Sometimes this hiatus hernia can be there since birth. In fact, if you pick up 100 people going on the road, do an endoscopy, 50 people might have this hiatus hernia. That doesn't make it a disease. Now this hiatus hernia, whoever has it, if they have these abnormal food habits, they are more prone to get this acid reflux if it is very small. So a patient with hiatus hernia is more prone to get acid reflux even with the minimal change in the food habits. Like for example, we hear a lot of times everybody in the house eats the same food but only some get this acid reflux. The reason is that they might be having a loose sphincter. So immediately when this masala or this spices or this bitter and tanginess touches that area, the relaxation happens more and then the acid easily comes back. However, a person with a large hiatus hernia, that is the same hernia which I am talking about, hiatus hernia, it is a bit large. These people are very prone to develop acid reflux and probably will need surgery for correction of these things. So now, abnormal food habits, abnormal food timings, that is lifestyles, and addictions, and presence of one, that is hiatus hernia, that loosening of the food pipe stomach junction, which we call as the hiatus hernia, are the common reasons why people develop acid reflux. What are the tests which are done for acid reflux? We sometimes do not need investigations. Automatically symptoms themselves show up that it is acid reflux. So a patient who is having this acidity problem, having retrosternal discomfort, most of the times has got this acid reflux. However, as I told you previously also, every patient who has this burning sensation doesn't need to have acid reflux. There can be other problems also which can cause similar situations. So we definitely need to do an endoscopy to prove that the patient is having reflux. Now, what is endoscopy? It is a small pipe with a camera attached to the tip which goes through the mouth into the food pipe and in the stomach, and we see what is happening to the food pipe, stomach. We see whether there are any ulcers, damage happening, strictures, narrowing ulcers, or cancers developing in that area, and then we come back. This is the straightforward simple test which is known as endoscopy, which is done to diagnose acid reflux. Sometimes people have a normal endoscopy and still have burning sensation. It means that the acid reflux is happening, but it is not damaging the food pipe. So that's why we didn't find anything on the endoscopy. For those patients, we do a pH metry. We know the word pH in our science, we have learned it. It senses the amount of acid. So we use one special test where we see or detect how much of acid is happening in the food pipe over the 24 hours time. Because acid reflux might be there now, it may not be there after 1 hour. So we can't just say that if we do a test immediately and say there is no acid reflux, there may not be. He might have had reflux before or after I have done the test. So for that, we do this pH testing for 24 hours in a day. So that means the whole day. A very small thread-like catheter is passed through the nose into the stomach, and we leave it there for 24 hours. And we attach that to one mobile phone type of syncing apparatus which has got some buttons on it. Now whenever the patient has got a symptom like burning, chest discomfort or cough or anything, then he has to press a few buttons designated to that. Like that, we ask him to live a normal life. We ask him to go back home, eat food, eat lunch, eat dinner, eat breakfast, sleep, and then record the symptoms which are happening over 24 hours on the small box which we had given with buttons and everything. Now once they come back, we remove this catheter, and then that receiver is loaded onto the system, and that whole data is analyzed by a specialist gastroenterologist who specializes in these procedures, and then he analyzes how much of acid has come. So even if the endoscopy is normal, if that 24 hours pH metry, we call it as 24 hours pH metry, if that test shows acid reflux, that means the patient has got acid reflux. So the two common tests which we do are, one is endoscopy, the second is 24 hours pH metry. A slight modification of this which we call as impedance pH metry, where we also see along with acid what is coming back. Is it solid, is it air, is it gas which is coming back and causing discomfort? That we call it as impedance pH metry. So even that is used to diagnose acid reflux. So three tests are used: endoscopy, 24 hours pH metry, and the third is impedance pH metry. So the treatment of gastroesophageal reflux disease is twofold. One, the most important, diet and lifestyle modification. Second, medical and surgical therapies. I will not discuss about medical and surgical therapies first, because the most important treatment for acid reflux is diet and lifestyle modification. Eating on time, avoiding unhealthy habits like smoking, alcohol drinking, tobacco chewing, etc. and avoiding late night foods. Having minimum 2 to 3 hours of gap between your last meal and the sleep. These four good healthy habits are definitely necessary to prevent acid reflux. In the night when you sleep, a patient who has got very bad reflux, we ask them to elevate the head region a bit so that your head is above, so that the gravity will not allow so much of reflux. If you have the food, the stomach and the chest and the head in this direction, acid can easily come back. Whereas if it is like this, that is the head here, food pipe here and the stomach in this position, then the acid takes difficulty in going back. So we ask them to elevate the head end of the foot. Now previously in olden times, we used to ask them to put 1 or 2 bricks beneath the bed, but now the present generation beds, it cannot be done. You really can't lift them. So what I would suggest is you just lift the mattress. Don't use extra pillows. Some people have a habit of using 3-4 pillows so that their head end comes up. It is good for a day or two, but what happens in the long run, if you use it for months together, you will develop cervical spine related pains. So please don't do it. You put the same pillow beneath the mattress. That is, you lift the mattress and put the pillow beneath it, 1 or 2 pillows depending upon your need. Now what happens is that the mattress itself raises. So it's just not the neck which is on the higher position, it is the chest and the neck in one level which is above. So this will not cause any chronic neck related issues. So the third thing is food. What you eat is very, very important. Okay, so avoiding oily foods, high oily foods, spicy foods, masala foods, bitter and tangy foods is one of the most important things which is necessary for preventing acid reflux. Now, once this question is, I keep telling my patients, immediately they ask me, sir, shouldn't I ever eat these things? Like for example, they say biryani, it's a common thing in Hyderabad. So they say, sir, shouldn't we ever eat biryani in our life? So the answer is not that. I said reduce the quantity and the frequency of these particular foods. For example, if you want to eat this high oily masala spicy foods like biryani etc., use it once in a while. Once in a week or 10 days is good enough. And even on that day, your whole meal shouldn't be biryani. It should be a small part of the meal. On that day, you increase the amount of healthy foods like fruits, curd, etc., which can counteract the bad part of this particular abnormal foods. So, avoid eating or reduce the quantity and the frequency also of eating of oily foods, masala foods, spicy foods, bitter and tangy foods. So, good diet control and a lifestyle modification is the most important treatment for acid reflux. Now, why did I tell you about this first and not the medicines? Because medicines will definitely reduce the acid reflux. But if you don't follow the lifestyle modification, this problem comes back immediately. So, my patients keep asking, sir, acid reflux is a chronic problem, will I not get rid of it? My answer is yes, you will never get rid of it. Okay, to explain this, I'll give you a small example. You have your bike or a car, you drive it. If you drive carefully following traffic rules at good speeds, maybe 30-40 kilometers per hour, you can avoid accidents. You may have accident also, but rare chances. If you drive in a rash way, it causes accidents. So once you have an accident, you take your vehicle to a repair shop and get it fully tinkered and then painted and then come back. And now again, if you drive it in a rash way, again you will have an accident. So now here, if we compare it to our reflux, the treatment for this particular problem of accident is not going to the shop and getting it repaired, which is like my medicines. The treatment is driving carefully, following traffic rules and avoiding high speed driving. Like that, avoiding eating unhealthy foods and avoiding these unhealthy habits is the main motto for treatment of acid reflux. Medicines and surgery will help you. Definitely your symptoms will go away. But the moment you stop them, if you come back to your bad habits again this problem will come back like a ball bouncing back to you. So, good healthy habits, good healthy lifestyle is the primary treatment for any acid reflux. Now, coming to the medicines, we have very good medicines. Previously, in the olden times, we used to use H2 blockers. We very well know by the name Rantac, now Famotat, etc. So many medicines are there. These were having a good acid control but not very good. After that came a generation of medicines which we know as PPIs, proton pump inhibitors. These are excellent medications. These medicines cause your acid output to become zero within a few days of taking this medication. They are so powerful that your acid actually becomes zero. Now, in fact, after this PPI medications have come, that is proton pump inhibitors, PAN, Razo, pantoprazole, rabiprazole, esomeprazole, etc. These medicines have come into the practice. The surgeries which are done for the acidity problems have actually come down. 2 decades before, the acid surgeries were very, very common. Nowadays, hardly I see a patient undergoing surgery for this acidity problem. So that is the power of this proton pump inhibitors. So these medicines are used along with some other medication which we call as prokinetics, which help in increasing the movement of the intestine so that the food and the acid actually move forward and don't come back. These medicines help in reducing the acidity, helps in improving the food pipe health, the health of the intestine, that is the ulcers, everything heal, and then the acidity related problems come down. Now, apart from this, we also give medications to improve the stress level for patients who are having an extremely stressful life, and because the stress causes acid reflux again. So, as a part of the lifestyle management, we also need to reduce the amount of stress because stress increases the acidity and that causes this particular problem. So, in medicines, we have 2 important categories. One is the H2 blockers, and that is the Rantac group of medications, and the other one is the proton pump inhibitors. Along with that, we add some more medicines to improve the movement of the intestine, which causes the food and the acid to move forward and prevents the acid reflux. Now, apart from that, we give instant relief syrups. There are some syrups which contain antacids. This help in neutralizing the acid. We know acid-base neutralizations, which we have read in science. The same base we give in the form of a syrup so that some instant relief happens to these patients. The third modality of treatment is surgery. So what exactly happens in surgery is that the food pipe sphincter, which I told is a bit loose, will be enhanced. It will be tightened with the help of some surgical technique where the stomach is wrapped around the food pipe so that the acid reflux actually comes down. This is one more treatment modality, that is surgical modality to control the acid reflux. Apart from this, of late in the newer era, through the endoscope, we the gastroenterologists are able to reduce the reflux by creating this tightness in the lower esophageal sphincter through an endoscope, not using the surgical technique, which I'll describe in a later stage. So, diet and lifestyle modification, primary modality of treatment, acidity control medications and surgery are the treatment for acid reflux. Endoscopic therapies have come up in the last decade. This is in the last 5 to 10 years, the endoscopic treatments to reduce the acid reflux and to tighten up the lower esophageal sphincter have come up. There are two main procedures which help from the endoscopic point of view. One, which is known as the ARMA arms, anti-reflux mucosal ablation, anti-reflux mucosectomy, where we create an ulcer just below the food pipe sphincter so that once that ulcer heals, it tightens up that area. This is done through the endoscope. It takes around 30 to 45 minutes to complete the procedure, and the patient can be discharged on the same day, and the patient comes back after a month or so for repeat checking, where we find that if the sphincter was a bit loose, it would have become tightened because we have created an ulcer below it using some special techniques. The other technique is known as GERD-X, G-E-R-D-X, where we use a special equipment with clips inside the food pipe and create a surgical wrap. Like for example, in surgery what they do is the food pipe and the stomach is there. The stomach is sutured over the food pipe so that the food pipe becomes a bit tight. Now we do the same thing through the endoscope. Now in this GERD-X, we have a special equipment which goes through the food pipe and we apply clips inside so that this particular stomach is sutured around the food pipe. It is sutured from inside. In surgery, they do it from outside through the laparoscopy. In endoscopic technique GERD-X, we suture it from inside and we tighten that food pipe sphincter so that the acid reflux comes down. This GERD-X is a simple procedure. We do it in approximately 20 to 30 minutes of time. The patient need not be admitted unless they have an insurance. The patient can be discharged on the same day also, and the patient can start eating on the same day itself. So for a couple of days there will be small diet restrictions that they will not be able to eat solid food, but after a couple of days they will be able to eat a normal diet, and we recheck these patients for acid reflux after a month or so. Endoscopic therapies are like a boon for these patients because these procedures do not require much of admission. They are relatively pain-free and the patient recovers very fast. These endoscopic therapies can be done on an outpatient basis and the patient can go back to work the immediate next day with no major restrictions in the food or the lifestyle. In endoscopic therapies, to summarize, we have two techniques. One is the ARMA arms technique, where we create an ulcer below the food pipe sphincter and tighten it up, or we use special clips to tighten up, where we call it as the GERD-X.